on the device you have there. All right, folks, thank you for joining us, and I appreciate the forbearance. Mr. Roman, thank you very much. We have a very dedicated tech staff that was here helping us get online, and I appreciate that very much, Roman. It's pressure-packed and difficult to do something like this, so I want to really just acknowledge you and thank you for that. All right, you'll head over to the tech department, and you're watching online while this is happening. Folks, my name is Diego Ochoa. I am the superintendent of the San Mateo-Foster City School District, and I am here tonight with a special guest, our county superintendent, Nancy Magee. Nancy?
Hi, everybody. Really great to be here. Looking forward to the conversation.
Thank you for being here. She reached out to me a little bit after she heard about this event and said, hey, Diego, I'd be willing to sit with you so that we can reach out to these families and talk to them about the district's approach to COVID-19, as well as just an overall county approach, sort of an update on what we're seeing countywide. What we're going to do tonight is we're going to start by going over the core components of the district's Safe Return to Schools plan. And it's really based around a series of strategies that we identified that really align very closely to the California Department of Public Health guidance that was given to schools in terms of preparing for the 21-22 school year. So that started with mask wearing. So as you know, we have a requirement that all individuals, including students, wear masks when indoors on school campuses. And what we're actually seeing, Nancy, I don't know if you've heard this from other districts throughout the area, is we're seeing a really high percentage of kids keeping their masks on even when they're outside.
Yeah, not surprising at all, because, you know, actually, even when I go out on the weekends, families are out hiking or, you know, shopping, all family members have masks on. So it's so great to be in San Mateo County, where everyone really understands the importance of mask wearing during a pandemic.
Yeah.
So I think
we're lucky. We're lucky.
Absolutely, and but the students are really, you know, learning from the models around them, and I think they'd rather be at school than at home, so they'll do whatever it takes.
Yeah, and we're definitely seeing that. Another component of our Safe Return to Schools plan is the use of hand sanitizer, which you see at the bottom of your screen there. We've got a bottle here in my office, but also you see hand washing happening at all of our schools, either in hand washing stations or in sinks or in restrooms throughout the district. In addition to that, cleaning on a daily basis is a really key strategy for us to be able to knock out those high touch areas and to really focus on disinfection that would negate any kind of COVID presence on physical objects that are considered high touch. So those are things that we carried over from the spring. I think what parents saw when school reopened in 21-22 was one of the biggest differences, what physical distance changed dramatically. And the reason is that the state of California, the California Department of Public Health, as well as the California Department of Education, really prioritize kids back in school.
That's right. That's the #1 priority for the year.
Is kids in school. So with that, they said, we know pretty much every classroom throughout the state is about 900 square feet. Different shapes in different schools, but pretty much about 900 square feet. You can't space kids 6 feet in a classroom and have 25 kids in a class. So that's the reason they took the social distance and they changed it to as much as possible or as appropriate.
In San Mateo County last year, we ultimately moved to a 3 feet kind of guidance. So I think most,
and that was early because many districts didn't do that.
Yeah, most classrooms I think can get, you know, everybody in that they need to with about 3 feet.
That's right. Then we recently had an update to our plan because the state of California, only about a week and a half ago, put a requirement in that by October 15th, every staff member either be vaccinated for coronavirus or consent to weekly testing for coronavirus. And that wasn't in our original plan because that hadn't been put forth by the state of California. So that's something that as superintendents, you've actually taken us all through that process. You're sharing information with us, and now every district by October 15th will have one of the two, fully vaccinated staff and or staff members who are taking tests every week.
That's right, and it takes a bit, I mean, it's a big lift to get school started and to institute your testing protocol and to collect data on all your staff members. And you do have students who are vaccinated, so you want to collect as much information as you can.
That's right.
So you know who needs what kinds of protections.
That's right. In addition to the staff testing and the staff vaccination, the hand washing, the hand sanitizing, the cleaning, the mask wearing, the district also purchased air filtration systems for
Yeah.
each classroom. We have 2 air purifiers in every classroom throughout the district
Yeah.
that circulate that air, that get that air moving. We also have our air conditioners set so that they push new air into the classroom and doors and windows open to the maximum extent possible. So in a classroom, you've got air moving around in a way that we couldn't do a year and a half ago because we didn't have any of those components. We didn't have those physical tools. But the district put quite a bit of money into those HEPA rated air filters. And that has made a big difference. We also asked parents in our Safe Return to Schools plan to go ahead and keep your kids home if they feel sick.
Right, that's critical.
That is
yes.
so, could you talk about that, Nancy?
Absolutely. I mean, that's where the social responsibility that we all have to ensure that every student has the opportunity to go to school every day and that our staff have the opportunity to come teach in a safe environment. It's a simple choice that, oh, well, you know, you might have a runny nose or a little bit of a sore throat and you feel okay. But this year, in this time, these are the times when you might, as a parent, say, I'm going to have to keep my child home today because it's about everybody else. And we've got to protect the educational program for everyone. It's also, good modeling for kids that when they do have symptoms of sickness, that they do stay home and take care of themselves.
That's right. The district also has a plan to initiate something called pooled testing that we'll go into more as the night progresses. And basically the way pooled testing works is we have a plan in place that is designed to be able to have every student who has a parent permission slip to be able to receive a COVID test every week moving forward. We're looking at that first or second week of September as the initiation of it.
Yeah.
And the way that it would work is we bring these staff members into the classroom and we give kids a Q-tip. It's about that big, about the size of a regular Q-tip that you would use in your ear. And we teach the kids how to make those circles on the nostrils, just like that. We've got a container that looks like a cookie tin. And then the Q-tip goes in, as the company explained today, boogie side down. So the part that was in the nostril in, down. And what happens is they actually take the container with all of the Q-tips from the students in that class in for testing. When they test that container, if it comes up positive for coronavirus, they come back and do a rapid test with each student to figure out who in the class may be positive for coronavirus. And the reason that's so critical is because it tells us who has it when they're asymptomatic or when they don't feel sick. The sooner we find that out, the sooner those tests go home. The students are then at home for the 10 days of their coronavirus incubation. So that's our plan for pool testing. You and I have discussed it briefly. And
it's also a great balance of when you do pool testing, you're going to end up with most of your pools testing negative. So you can just keep moving to the next classroom, and let those teachers and students really dig in and focus on their learning for that day. And yet, if you do end up with a positive result, you're doing it in a very targeted way. And are you going to use the rapid results tests you said as a follow-up to the pool testing?
It is.
Yeah, that's
so
great.
It comes in right after.
So it's about a 15-minute time lapse on those rapid results. And The public health officials that I am meeting with, which is a lot,
Yeah.
they really speak highly of the efficacy of the antigen tests. So when they first came on the market, there was a little bit of a question about were they as accurate and were they giving false positives, but actually they got better and better. And now many of the UCSF doctors, they prefer the rapid antigens, because it's actually catching you in the 10-day infection
That's
period.
right. That's the big change. Yeah.
And whereas a PCR test can catch virus on either end of the
Yep.
infection period and actually give you a positive result when you're not infectious.
Yeah.
So the rapid result tests are really highly effective.
Yeah.
And easy to use in schools.
Mm-hmm.
Last year, the state was testing the rapid tests, and there were 3 counties in the state that were doing pilots.
That's right.
San Mateo County was one of them. We had 3 districts that piloted the rapid antigen and helped the state officials learn the best way to use them in schools. So now they're available to students across the state of California, and the county office is actually going to be the distribution point for the Binex Now antigen tests. They're not going to distribute them from the state to the district. They're going to distribute them to the county office. Then we can get them to the districts as they need them in a little bit more efficient way.
That's right. And see, that's why I invited Nancy tonight, because she has so much access to information that I don't get. You know, this is the system in California is the state has information that's provided to all county superintendents, you know, because
That's
you
right.
represent all the students in San Mateo County, which is thousands and thousands of students. My school district is 11,000 students. It's probably 4 times that size when you add everyone in countywide.
About 90,000 students in San Mateo County.
That's right. So just a huge number countywide. The other thing that we recently published district-wide that we're continuing to get feedback about is this document here. It's the Covet Dashboard. And the Covet Dashboard is important because what we're doing on a weekly basis is we're updating this document on Monday mornings at about 8:30 or 9 a.m. And what we do is we bring together all the cases that happened in the district, and we put them on this one dashboard. And in addition to that, right below this visual is a PDF document that you click on that shows you specifically where the cases took place in terms of the school and the district. So if you're a student if you have a child at Baywood Elementary School, you can look at the district's cases, 14 cases, but then you can click on that extra document to see specifically were there any cases at my school. And that's a very important piece for us, is to give the parents access to pull those pieces of information.
Yeah, some districts are doing dashboards, so it's really great that you've got yours going. I do, put a word of caution out to the community that just because you've got numbers of cases, there's a lot of information to know about those numbers. We've had a household that had COVID. There was 3 siblings. So in one school, all of a sudden, you've got 3 cases. But it actually, county health counts that as 1 case because it's 1 family, 1 transmission, 3 students that will go quarantine. But you have to kind of know what's behind those numbers. And I would also say that it's holding true that COVID is not spreading in schools.
Yeah.
That through the contact tracing process, which happens with county health,
That's right.
most of these cases in schools are coming from the community, which makes sense because we've got high community transmission.
That's right.
In the school setting, we have so many layers of protection in the safety protocols that the spread is really mitigated in schools. There's lots of eyes on, lots of people paying attention. Everybody's updated on the rules and the changes.
Right.
So, and everyone's also very motivated to continue coming to school.
That's right.
So, in a school setting, these protocols are being very well enforced
That's right.
and implemented. And the health officers continue to say that they're not seeing spread in schools. There may be some anomalous, examples of it happening,
Sure.
but it is not the trend.
And even in our cases, when we conduct our contact tracing, what we are finding out is when there is a case, you'll find out that there was a party that happened the weekend before.
Yeah.
There was a get together that involved families from different classrooms at different schools where individuals were unmasked
Mhm.
for 3 hours playing sports with each other. So there are a lot of those kind of examples that we hear about, and our take on it is share the information with the families so that they can have it. And I receive somewhere between 50 and 100 emails every day from different people in the community about the issue. And our approach is to just say, get back to everybody. Give
Mhm.
everybody that response, get everybody that information. Now, you can't see on the YouTube live stream, but we do have two dedicated professionals here with us. One is our Director of Curriculum and Instruction, Pam Bartfield, and the other is our Communication Specialist, Diego Perez. And they're taking all of your notes from the live chat, and Diego's gonna hand me my first sheet of paper here. It's a group of 7 questions, and myself and Nancy are gonna do our best to answer these because we really want the input from the community tonight to be addressed. And the first that I'm going to go to is when there's a positive case, can we notify all classes at the same time? So let me explain how that works. I received a notification last night at 1 in the morning about a positive case.
Mhm.
So these notifications come in at all hours of the day and night. And so it takes us about 8 hours when it happens overnight to conduct the contact tracing. Because our first responsibility is to find out, do you have any siblings? Are you in an after school program? Are your parents sick? Do you think you have COVID or do you actually have a positive COVID test result? So there is quite a bit of interviewing, I guess you could say, that we
Yep.
have to do.
Mhm.
From this point forward, when there is a case at a school, every family in the school is being notified that there is a case at their school. It's a very generic letter telling you that there's a case. If you're a close contact, you'll get a different letter, much more detailed, a lot more information. So thank you for that question. We have a question here as to whether or not we will mandate negative testing before returning to school after Labor Day. And thank you for that question. That isn't something we're going to do for a variety of reasons. We have a lot of mitigation strategies in place now. We have students following those strategies. We have in the community, we have free testing at a number of different locations, namely the Marriott Hotel here in San Mateo, where any parent, we have 560 parents watching, talk to your friends and neighbors, encourage them to go get a COVID test. We can find out sooner if somebody has COVID or not. Putting a requirement that it take place before that day would really create some issues for families that can't get to that.
It's not logistically practical.
And it's not practical because we have 11,000 students in the district and an additional 1,200 adults. So we don't have that capacity to initiate that kind of a requirement before we come back from a 1 week break. Having said that, our plan is to implement pooled testing very soon in a way that will result in all of our families that have signed permission slips to receive that COVID testing. So thank you for that.
And what is your percentage of permission slips on the COVID testing? Are you doing pretty well?
We're doing very well. We have 7th and 8th graders that have already received the COVID vaccines as well. So that changes it a little bit.
Right.
But the number right now is really high, and we're just doing some sort of sampling because we don't have the forms out to the whole district. But we believe it's going to be equivalent to the vaccination rates in the county, which, as you know, are up in that 90% range.
Right. Okay.
And others will opt out, and that's okay too, because
Yeah.
we have other mitigation strategies there. We have a question on why not cohorts in middle school. That's very restrictive in a scenario where we're doing in-person instruction. The reason is at the middle school level, teachers have different credentials.
Right.
So a math teacher just can't teach wind ensemble. And you know, you and I have been educators a long time.
Right.
The single subject credentials really change things.
Yeah, everything's different at the middle and high school level. The California Department of Public Health dropped the cohorting guidance. It's not part of the school guidance this year because again, we've got higher levels of vaccinated individuals in the schools, number one.
Yep.
Especially at the middle and high school levels, because those kids can be vaccinated.
Yep.
It really interrupts their instructional program.
Yeah.
And the goal is to get kids in school. So the cohorting guidance was dropped across the board in the state guidance for schools this year.
Then we have the question, why not individual testing versus pool testing? I just want you to understand, individual testing would mean 11,000 students with individual tests. No district in the county has the infrastructure to individually test anything close to 11,000. Now, pool testing, what it does is it creates that ability to test entire schools in one day, in just a couple of hours, actually. Then you come back the following day with that rapid test because it's functionally not smart to line up 500 kids at Audubon Elementary School and get them in line for testing because it would take hours and hours.
And there's that's a logistical school operations piece, but the public health officers actually are not promoting surveillance testing in schools. So that is when you would test everybody in an individual test and get results. San Francisco Unified is not doing any testing in that way because they're following their health officer guidance. There's a protocol called response testing. So that's what you're doing is you're pooling. And when you have a result, then you're going in
Coming back
and testing individuals. Yeah. That's called response testing. It's highly recommended by California Department of Public Health.
It's one of the highly recommended strategies. Now, here's a question for you. When would districts consider distance learning?
Well, districts don't have the option to consider distance learning.
And
right
that's, you know, and we have said that, right, Nancy, multiple times.
Yeah.
We're prohibited from doing distance learning.
It's not part of the legislation. The legislators heard from parents loud and clear last year that distance learning was not productive or positive. And the legislators wanted to make sure that schools were as close to normally functioning this year as possible. You can go lobby your legislator to address this issue because it would be great just to, if a class is quarantining, just to slide right over into distance learning for that quarantine time and then come back. I did actually work with our legislators on advocating for that, both for quarantine and any kind of emergency smoke days or anything like that.
Which are likely coming at some point.
Yeah, but I think they just were nervous that distance learning would be poorly received by families and parents. So
they put the brakes on it.
They said totally it's not allowed.
Yeah.
Yeah.
We did get a question about staggering lunches. At almost all of our elementary schools, and we do have a couple of really small elementary schools, but we do stagger lunches. At our middle schools currently over at Burrell, as well as at Bayside, we're doing what's called they called it the Bayside Switch when I spoke to the principals this morning, but basically we tell the 6th graders to play for the first 20 minutes while the 7th and 8th graders eat. And that brings down the number of kids. And then some school employee blows a whistle and the kids switch. So it just keeps the numbers down. We are looking at that at our 2 other middle schools as well. Because I think anything we can do to get those numbers down a little bit is a positive step. So thank you for that question. And Diego, you have a couple more sheets there for me. So we're going to go ahead and jump on those. Here's my next 6-pack. We've got why no distancing in the classroom? Why no distancing in the classroom?
That's because with the there's a lot more. There's a universal mask rule this year from California Department of Public Health indoors.
Yep.
And the approach of public health is that we've got a layered approach. One layer is masking, one layer is health and hygiene, stay home when you're sick, contact tracing, testing, adults are vaccinated. So between all of these layers, if you want all your students in school every day, all day, physical distancing is counterproductive.
Yeah, it wouldn't permit it.
It wouldn't
We
permit
would
it.
have groups and we would have hybrids and we would have all kinds of classes chopped in half. And really, the legislature and the Department of Public Health said kids in schools. That's the priority.
And it's not just about kids in schools. We really did see that students across the country suffered last year.
Yeah,
Our students deserve to be in classrooms with caring, talented, professional educators, engaging with their peers and developing their social emotional skills.
that's right.
Some of your students may have done really well in distance learning, but in general, if you take the entire population of, the country, students really have suffered under distance learning.
It was a step backwards for a lot of kids.
Yeah, we've got to lean in, and we are going to be with COVID for a while. It's not going away.
Yeah.
We'll probably be with it all year.
Yeah.
People may not want to hear that, but
Yeah.
we kind of have to get our grit going about we care about our children's development and academic progress.
That's right.
We want the best for them. We can have them in school.
Yeah.
As long as we're following the layers of safety protocols.
That's right.
So.
We got another question on distance learning. And the question is, should we do distance learning until we have vaccinations for 12-years? But we're not permitted.
We're not permitted, and I think it speaks to the point we just made, is that really students do so much better in school with their teachers. And so that is the priority for the state of California this year.
We've got a question about Bowditch Middle School. The question is basically related to that lunch situation. How can we create a different lunch scenario at Bowditch? So I have a visit tomorrow during lunch to Bowditch. I was going to go today, but today's a minimum day district-wide, so there's no lunch.
Okay.
So I didn't get a chance to get over there today, but tomorrow I'll be with Principal Bowers, and we'll observe the lunch and initiate a site-specific change to reduce the numbers. We obviously have to look at it together and work through it, but thank you very much for that question. We have a question on the dashboard. Can it have cumulative cases? So the way we're using the dashboard is every single week the cases are up, and you'll be able to always pull up the prior week. So it's a way for you to know how many cases this week. It's sort of 6 of one, a half dozen of another. If we give the cumulative total, people will ask us to give it just for the week. So we chose weekly, and all you've got to do is click on that extra visual and you can pull it right up.
Right.
Yeah.
Yeah, and the public health officials only look at data in a 30-day window.
Yeah.
So every 30-day window, they start a new set of data.
That's
so
right.
You don't want to get too cumulative, I don't think.
That's right, because then there's, the start date and the end date aren't really clear to the reviewer of the data.
Right, and it doesn't really tell you what's happening right now.
Yep.
I think your daily or your weekly data is the most important data to be paying attention to.
We've got a question on close contacts. If your child is in a class with other students and a student in that class, let's say the class is a second grade class with 22 kids, and we get a confirmed positive COVID case for one of the 22 students, it is very likely that the other students in the class in our district will be deemed a close contact. So that's new for us over the last week. We've seen a bump in cases at Foster City Elementary School, and that really caused us to look a little bit deeper and a little bit more closely at how we're identifying close contacts. And for that reason, it's initiating the modified quarantine, which is when you're a close contact, we want you to take a COVID test. We want you to share the results with us when you get those COVID tests. We want you wearing that mask at all times and refraining from the after-school sports, the after-school care, the extended school opportunities. to keep you in what our priority is, the regular school day.
Right, so you're going above and beyond the guidance in that the modified quarantine says that if you have one positive case, kids can continue to come to school in modified quarantine as long as they have no symptoms,
Yeah.
are wearing a mask, and they test, right? Like every 3 days for 10 days.
That's right.
And I think you're instituting a process of, are you sending the entire class home?
So what we're doing is we're saying to the class, please go get tested tonight.
Oh,
Get tested tomorrow morning. You're
Okay.
welcome to come to school,
Right, okay.
but we do need that result when you get
Yeah,
that result.
so you are doing the modified quarantine per the protocol.
Yep,
Yeah.
we're just expanding the number of kids. So
Uh-huh.
2 weeks ago or 3 weeks ago, we might have said only the students who are
Only-
absolutely closest
I
to that
gotcha.
student.
Okay, so now you're testing the entire class.
Now we're going and saying
Right.
the close contact are the students on the roster.
Right, that's good.
So what that means for my middle schools is these kids are in classes with 162 kids. So what that means is 162 kids are close contacts.
Uh-huh.
So it's a big increase in that number.
Yeah.
We think it's going to lead us to find out who may have COVID now and mitigate spread. And that's our reason for doing that.
Right.
I do have my next 6-pack here for you all. So thank you, Diego and Pam. Keep it coming. We've got a question regarding how we open up lunch so that there is less congregation. And again, our tact is get those kids playing, 1 grade level, and then the older grade levels, get them eating. At the elementary level, some of these schools' lunch will start at like 10:55 and end at 1:15. So we try to spread them out as much as possible by grade level, but each school is a little bit different. You know, some schools have big fields where you can do lots of spreading. Other schools, not quite as much. So those are our mitigations to get kids more space out there in those open areas. We've got wire masks optional at recess. So that's been a big topic of conversation. As you know, the guidance is to wear the mask when indoors at all times.
Correct.
And then I have my own view on it. What's your take on it, Nancy? Why leave it optional for outdoors?
It's such a community conversation, I think it optional is really nice because children who feel more secure with their mask on, they get to wear it and it's okay.
Yeah. Parents
who want their child wearing a mask, it can have that happen.
Yeah.
Some parents may believe that I want my child to be, have free flowing air and oxygen and let the, wind and sun blow on their face. And that's what they need for their mental health and their best, to be their best selves that day.
Right.
So parents know their children, and you can guide them in what your own family concerns are. Is it about, a little bit more, let the kids run without masks a little bit? They get to do it at recess.
That's right.
So I think the optional thing is a good way to go.
And our local, health experts are telling us the outdoor transmission is really, really, really low.
Yeah,
so
outdoor is another layer of protection, basically.
That's right. It's another mitigation strategy in that sense. Yeah. So those things combined, I think, add up to how we ended up here. We've got a question on dismissals, especially on Wednesday. So I want to honor that from the parent that submitted it. I'll work with our principals to have a conversation about dismissal staggering. I think our district is definitely open to any idea that comes in. So we really appreciate this question. At present, depending on the grade level, we'll have different dismissal times. Kinders tend to have earlier dismissal times. TKs tend to have earlier dismissal times. But every school's a little bit different. And I just want to thank the parent for submitting this question, because right now we haven't used that as one of the many strategies, but we're open to it. So we'll take it up on advice.
Yeah, and what I'd say about that is, we've had school districts starting school from 2 weeks ago, and last week, and then this week, and then next week, and the week after that. So we've got this sort of staggered start of school across school districts in the county.
Yeah.
And it takes a while to kind of get like you can only focus on so many things at once.
Yeah.
You want to ensure that the safety layers are in place for that first week. Then you also want to kind of see how the flow is going on your campus, and you learn, you iterate and make adjustments as you go. And so that makes perfect sense that you're still sort of working through some of those fine details.
That's right. Now, we got a question on travel. So this is one of those situations where, we don't dictate to parents where they travel or when they travel. We don't want to do that.
That's right.
But it's an issue of community interest. So if I, as a father, take my children to go visit my family in Los Angeles, and we have events where we are unmasked, and I'm in Los Angeles, I'm just here in the state of California, down south, and I come back to San Mateo, I'm taking a test. I don't want to get my coworkers here at the district office sick. So that's sort of the standard that we want our families to be using, because we have to define travel. So in my family, driving 4.5 hours is travel. Now, in your family, it might mean getting on a plane and flying to Israel or to any one of a number of countries that our families travel to. When that happens, when you come back, for me, it's about taking that test to be certain. Number two, do not send your children to school if you or anyone in the family feels sick. Wait it out, get the COVID test. And then three, communicate to your school principal, because that's a very important strategy to help us all remain safe.
Yeah, and there's no requirement to to implement travel restrictions.
That's right.
Very difficult for a school district to do that.
Yeah.
And but your own school community can make it part of your culture.
Yeah.
That create positive messages that you share in your newsletters and at your PTA meetings about, test when you travel.
Testing and traveling.
Yeah.
Travel safe.
Yeah.
Yep.
And just build that sense of personal responsibility and to protect the school community.
Here's an excellent one. Why are we not implementing all of the spring protocols, such as temp taking and health forms?
Well, the public health officers actually, they did a lot of research on the symptoms screening.
Yep.
And they actually found that temperature was not among, the temperature taking was not a good indicator of potential COVID. And there was a lot of time and energy being implemented to stop everybody and take temperatures.
Yeah.
When it really wasn't giving us the information that we originally thought it was. Remember that 18 months ago in March of 2020, we knew nothing about COVID.
Yeah.
And the health and science community has learned so much.
Yeah.
And we are guided by the best medical experts in the country. We've got Stanford doctors on one side and UCSF on the other.
Yeah.
They're right in the mix of all of our conversations.
We're very lucky.
Oh, so lucky.
We're extremely lucky. We have dedicated, brilliant professionals who know this business.
But they're the ones who dictate. No, I shouldn't say dictate, but they're the ones who state that the temperature taking is not worth the time to do it. So let's focus on more important things.
Yeah, we have a question here. This is more of a district question. With so many more cases, how can we think that our protocols are working? So that's an important conversation for us to have. When schools initiated on August 13th, it was a Thursday. So we were in for 2 days. And that week we had cases right off the bat. What we found in those cases was the transmission was in the community, not at school.
Right. Every school district that has opened has had cases on day one.
That's right.
And that's because in San Mateo County, we have high transmission right now.
Yeah.
The good news is that we are plateauing right now. And this week we had a little dip in our number of cases. And the public health officials believe that, COVID is kind of like a roller coaster. You get on that upward spike trend and it climbs. It plateaus at a certain point, and then it really starts to dip down and comes down. So We're anticipating that over the next month, we're getting to the downward slide, but you're gonna see cases in your schools as long as there's COVID in the community.
That's right.
And it doesn't mean that school is dangerous or that school is making it worse. In these cases, people are getting COVID in the community and coming onto the school campus.
That's right.
It's the protocols that are stopping it from spreading in the school campus.
That's right.
So,
and the way we know that is because when we contact trace, we ask families, okay, you had this event on a Sunday morning and you had 12 people in your family there. How many of them have COVID? Oh, 7 of us. Okay, that's an extremely high percentage.
right.
Now, your child came to school on Monday and didn't go home until Tuesday. There are 26 kids in the class. No one else got COVID. Well, our mitigation strategies are working.
Right.
Because in
the
school,
mask is
this-
60% effective, right? Right there.
This,
Yeah.
the air filtration, the distance that we can, that's feasible, the messaging, stay home if you're sick. So there's so many mitigation strategies. We've got those layers. You can think of it like layers upon layers of mitigation. We've got question about whether cases are coming from home or community. I feel like we addressed this, but
Right.
we're seeing community spread.
And you know, the home is the community. You know, when someone you know, has someone who's positive in the family, the kids should probably take tests or be quarantining as a family group and not coming to school.
There's a question on why not weekly testing and is pooled testing enough? And that kind of falls into the category you discussed earlier,
Yeah.
which is the recommendation is for this sort of
Response testing.
response testing,
Yeah.
not
proactive testing, because there's so much COVID in the community that you're gonna pick up all kinds of false positives.
Yeah.
And you're gonna actually create a lot more disruption. So the doctors say, yeah, response testing is the recommended.
And just as a time marker, we're at 6:16.
Okay.
I'm looking at 3 sheets, each with 6 questions on each one. So thank you folks for doing that. The rest of our questions, you're gonna put in an email. After this is over, we're gonna write responses. So we've got 18 more questions we're gonna answer. And then tonight, we'll send a response to all the families that are in our district that get an email from us that says, here are the responses to the remainder of the questions. So I'm starting, I don't know if you saw, but I'm putting stickies over on the side because they all relate to the air quality index. So we're putting that at the very end because that's something.
And I can speak to the smoke and COVID. So
we
have the big 5 protocols in place.
And we'll do it at the end of this. So is our priority student safety or kids in school? Our priority is always student safety. And the safe return plan, the CDPH guidance, the local mitigation strategies are all designed for student safety. Students are less likely to contract COVID in schools than they are in the community. If a child goes to a park unsupervised without a mask and is around other students, that is infinitely more of a risk than coming to school with this, the hand washing, all of the symptom screening and everything else that we do, the air filtration to go ahead and mitigate that risk. We've got why are the air purification systems, or how do we know the air purification systems are working? So thank you for that question. It's a matter of us monitoring that they're actually picking up and moving the air around. So in each classroom, those air purifiers are, you know, they're not super noisy, but they do have a hum to them. I'm sure you have them at the county office. And they actually have sensors that tell you the amount of particles in the air and how that is moving around. So I know you have that at the county. We have it here as well. It basically, when it's humming and it's on, it's moving the air around.
I was actually on an event Sunday with Senator Becker and 2 experts on ventilation from UC Berkeley and UC Davis. And they highly recommended the portable, just simple portable air purifiers are definitely improving your indoor environment.
Yep. We got a question on mask enforcement. We want it happening. So If you see circumstances where mask enforcement isn't taking place, please email your principal. They're your point of contact for that kind of thing. And that's something we will follow up on in our next meeting with our principals. We've got a question on lunchtime mitigation strategy. So again, lunchtime, being out itself in the open air is an additional layer of mitigation because you're outside as opposed to eating inside a classroom. Number two, at multiple middle schools and, in the days ahead, at Bowditch and Abbott, we will look into continued strategies to give kids more space so that not all the students are together while lunch is taking place. So thank you for that question. Now, I'm going to tell you something that surprised me when I spoke to the middle school principals this morning. They said, Mr. Ochoa, about 99% of our middle schoolers are keeping their masks on when lunch is going on. Because I said, let's do a big PR campaign. Let's convince these kids. They said, it's happening. We should be thanking them. And the reason they said is they want to stay in school.
Mhm. Yeah.
Sometimes as an adult, you think something's happening with kids. Well, you got to ask. You got to go see, right? And that's what we're hearing from our school principals. So very much thank you for that. And Diego, I'm ready for the next sheet here. All right, we've got, can the dashboard disclose positive cases in classrooms so that parents can decide to send their student to school? So, real clear here. If your child is in a class where there is a positive case, you are getting a very specific notification, an email notification from us. The dashboard comes out only once a week on Monday. So that isn't the communication strategy to let you know that you had a positive case in your class. Now, some of these schools have, 700, 800, 900 kids in the school. So you might get the generic letter because there was a case in a different grade level. But if your child is in the class where there's a case, it's very specific, explaining to you exactly what you have to do.
Yeah, and you guys have probably heard of HIPAA and FERPA. There's health confidentiality laws that don't entitle the general public to specific information that ties to a health condition. So you're only going to learn that there was a case in a classroom, and then those parents in that classroom will be notified.
That's right. So we got a question about why pool testing is taking so long to start. And this comes from the requirement that we bring in a vendor to implement the testing. So, as a school district, we have 1,200 employees, but let me be absolutely clear with parents. They are all extremely busy doing all the critical work we have them doing now.
Right.
So we're really bringing in a vendor to conduct this testing for us.
Yeah, and the state recognizes that it takes a minute to stand up district-wide testing.
Yeah.
So they've given districts until the middle of October to get that in place.
That's right. And our plan is September 13th. Is that second week in that first or second week in September, but
Right.
September 13th. We've got a question about how the Delta variant is different than the original coronavirus. I think both of us read news articles. We both are in meetings with health professionals. It's more contagious.
More contagious, and it seems to be infecting children at a greater rate.
Yeah.
The public health officers note that kids are not getting very sick with the infections. And the Bay Area health officers are actually gathering pediatric case data right now to put out a press release about, yes, kids are contracting COVID at higher rates, but they're not getting very sick.
That's right.
So
we've got a question on what is the protocol if a student gets COVID at school. Number one, if the student becomes ill at school, they come up to the office. We have a quarantine space. We contact the parent. We ask the parent to come pick up. We do 4 steps. Number one, we contact the family to ascertain all the relevant information so that we can start our contact tracing. Number two, we determine the close contacts. We send a letter to those close contacts. In many cases, it will be the entire class of kids for whom that student was with. We implement modified quarantine, which is get your COVID test, wear that mask, no after school or additional activities, and come back to school. Number three, we develop and send a letter to all families of that school. So even if it wasn't your class, you get a letter stating there is a positive case at your school. And then number four, we add that positive case data to our ongoing spreadsheet that we then update the following Monday morning at 8:30 to 9 in the morning. So that's the process we use. We have a question, why is carpet uh, time still happening? So those are classroom activities. Those are classroom strategies that when you are teaching children to read, it is very important to physically align them to the book you're reading so that they can see. If I stand in front of the classroom with a book that's this big, my students can't actually see that. In order to engage in the richness of group conversation, group work, for those youngest students, the carpet time really is an essential strategy. And again, with all the layers of mitigation, the symptom screening at home, the hand washing, the hand sanitizing, the HEPA filters, all of those strategies, and then we get back into our classes. We've got a question on what about backup distance learning for kids who are forced to stay at home? So what will happen if your child is ill with COVID? Your child's school puts together their materials, their additional materials that we send for the child to work at home. Now, there's two ways that that can happen. If the child is ill, we're not going to make them do assignments when they feel sick.
Right.
If the child is asymptomatic but waiting for their 10 days to lapse, then we want them doing their homework assignments and completing it and getting them turned in once they return to school. So that's the essential strategy. And Diego, I have one more sheet here, and we do have 5 minutes, so we have a luxurious amount of time to go through each one of these questions. We've got why not daily testing, and as we talked about, the type of testing that's being recommended by the health officials is not this kind of daily testing for the entire district.
Right, and that would be really a ton of resources, both
Yeah.
human resources and financial resources that aren't really going to provide an additional layer of safety.
Yeah.
So
We've got here, what would numbers look like if we removed the mask mandate? I would say neither of us is a statistician, but there are actually states and districts nationwide. The COVID rates in those areas that have no mask mandates are far different, but there are a lot of community factors. So not being a statistician, I won't really weigh in on it too much, but
that's kind of a crystal ball question,
yeah.
hard
And
to
I think
answer.
we all learned, stop doing that, Nancy. Nobody should think they have a crystal ball.
That's right.
Every prediction we've made has been wrong multiple times.
That's right.
We've got a question here on a timeline if mitigation efforts are effective. For me, it's a weekly and daily timeline. We are monitoring cases every day. We are monitoring mitigation every day. Our dedicated staff, and I want to take this opportunity to really let parents know who you have working for you out there in the San Mateo-Foster City School District. You have some of the most dedicated, incredible, wonderful human beings who care deeply about your children, and I am completely honored to work with the 1,200 people who wear that San Mateo-Foster City School District badge with pride, and they're stepping up for our students every single day, and I'm totally proud of the work that they've done.
Absolutely.
Yeah, not to mention our wonderful county superintendent. She's over here just taking care of business on all these questions. She's just been amazing, right? Pam and Diego, can we give her a round of applause? Actually, clap for her. Give her some support here.
Very not necessary.
We've got, how will the school handle a positive pool test? So that's great. So when there's a positive test in the pool, they come back the next day and they give every student and staff a rapid test. So you've got the 24 kids in the class, all 24 get a rapid test. Like you said, it's like 15 minutes, 20 minutes.
Right.
We find out, that student goes home. Simple as that. We've got a question about, can teachers say something to students who cough in class? I think every employee wants kids to feel healthy and safe. So what we want to happen in that scenario is we want the teacher to have that same kind of dignity and sort of, privacy in the sense of, hey, sweetie, I need to talk to you about, are you feeling sick? What's going on with your symptoms? Was it just, sometimes I just have to cough. I don't feel sick. I'm just coughing. So that's the step we want staff to take. Now, I've saved this for the very end, but let's talk about the air quality, because we
Sure.
got about 6 questions on air
Yeah,
quality.
so we have a protocol in San Mateo County for safe schools called the Big Five.
Yep.
And when there are air quality issues, the protocol is shelter in place.
Yep.
Students go inside. We have updated the protocols to include COVID safe response. And this actually was a big topic of discussion on Senator Becker's event with ventilation.
Right.
So there is a way to, you put your HVAC systems at a low rate of intake of outside air. You can run that with a little bit of outside air through your MERV 13 filters.
Right.
That still produces a healthy indoor air quality while you're also running your air purifiers.
Right.
If the air quality index was at 250 or above, which is really pretty
Very
extreme,
unhealthy. Yeah,
very
very
extreme, they would recommend that schools close at that point.
Yeah.
So as long as students can come to school, the environments in the classroom are actually probably safer and better air quality than if they were at home playing in the backyard or going down to the park and playing basketball with their friends or whatever it is.
That's right.
So you are going to close the windows and the doors.
Yeah.
You are going to run your air purifiers.
Yeah.
You're going to circulate
That's
with
right.
your HEPA filters, and you're going to be okay unless air quality index is 250
When
or
it hits a
higher.
number, that's right. And our process is, as a school district, we evaluate each school, right? Because not every school is the same.
That's right. You're geographically, different.
Very
Yeah,
geographic. We've got schools up in the hills. We've got
Right.
schools right, on the water's edge.
that's right.
So ours is a little bit different in terms of how we evaluate that, but we will pick a number and we'll communicate that to the county as well as to our public health officials. Our bottom line is we want kids healthy and we want kids safe. And then we obviously, as part of the framework, kids in school learning in person from their teacher, which we know is really desperately needed. So folks, it is 6:31. I am going to turn into a pumpkin in just a couple of minutes. Our county superintendent, Nancy Magee, came and joined us. Give her a round of applause again. Thank you for doing that.
Thank you to all of you for joining and being part of this really important conversation. It's really an honor to serve you in this county.
And thank you. You won't be back next week, but I will be back next week. We'll put
Great.
on another one of these events. We look forward to seeing you. We'll have an update. We've got Pam and Diego here with us. We had Susie Riley, our coordinator for student health, working through the night, texting me. That's what I was looking down multiple times. But everybody, thank you for the awesome job you did tonight. And parents, we'll see you next week. Same time, same place. Thanks.